Welcome to Medical Awareness. Here we will discuss about the various aspects of heartburn such as introduction, symptoms, cause, risk factors and lifestyle changes. We will also discuss heartburn in pregnant women. Introduction. Heartburn or pyrosis is a painful burning sensation in the chest just behind the sternum breastbone. The severity of the pain usually increases after eating or when lying down or bending over. Occasional heartburn is usually not a major problem. People can usually manage it with lifestyle changes. Frequent heartburn, on the other hand, can be dangerous and may require medical treatment. Symptoms. Symptoms of heartburn include: number 1, a painful burning sensation in the chest that can increase after eating. Number 2, pain that can increase when lying down or bending over. Number 3, foul, sour or bitter taste in the mouth. Number 4, a pain that resembles the pain of indigestion. Number 5, feeling of heat in the chest. Cause: normally when we eat something we crush it in our oral cavity mouth. Then we swallow it and food goes from oral cavity mouth to esophagus food pipe. In esophagus food pipe, food moves downward towards the stomach by the action of muscles. At the junction of stomach and esophagus food pipe there is a sphincter known as lower esophageal sphincter. It opens when downward moving food reaches here and allows the food to enter the stomach and then it closes again. The stomach combines food, acid and enzyme to start digestion process. The stomach has a special protective layer that prevents acid from causing inflammation in stomach. The lower esophageal sphincter prevents the backflow of digesting food from stomach to esophagus. But in heartburn patients, the lower esophageal sphincter relaxes abnormally or weakens, so stomach acid and digestive juices flow back up into esophagus. Because the esophagus does not have the same protection as the stomach, so the acid and digestive juices cause inflammation and damage to its unprotected wall. This damage and inflammation causes pain and sense of burning that we call heartburn. Risk factors. Number 1, large meals. When one eats a large meal, the stomach is stretched to the maximum. The stretched stomach puts pressure on the sphincter and it can open the sphincter. Stomach juices can go back and cause heartburn. Number 2, use of fried or fatty food. The use of fried or fatty food, fat-rich food, can relax the lower esophageal sphincter and allows the acid to flow back into the esophagus. Number 3, spicy foods. Strong spices can cause itching in the stomach and cause heartburn. But that does not necessarily mean that a heartburn patient cannot eat spicy dishes. People can tolerate small amount of spices without causing heartburn. Number 4, smoking. Smoking can cause heartburn. Regular smoking weakens the sphincter and can be a trigger for heartburn. Number 5, citrus and acidic fruits. Citrus and acidic fruits, tomatoes, grapefruit, lemon and oranges can worsen the heartburn. Number 6, obesity. Obesity can cause stomach pressure to rise, thus allowing the acid to flow back into the esophagus. Number 7, caffeinated beverages. Beverages containing caffeine, coffee or tea can cause heartburn. Number 8, alcohol, wines. Alcohol can increase the heartburn in multiple ways. On one hand, it can relax esophageal sphincter, and on the other hand, it can increase the amount of acid in the stomach. Lifestyle changes. Number 1, take a healthy diet which contains a limited amount of fat. Number 2, avoid eating before lying down. There should be at least 1 hour break between eating and lying down. Number 3, avoid stress. Number 4, sit upright while eating. Number 5, avoid eating or drinking things that increase heartburn such as spicy food, citrus and acidic fruits, tomatoes, grapefruits, lemons, and oranges. Caffeinated beverages, coffee or tea, alcohol, and full cream milk. Number 6. If you are overweight, lose weight. Number 7. Eat smaller meals more often. Number 8. Avoid smoking. Heartburn in pregnant women. Heartburn is common in pregnant women. There are two main reasons of it. The developing baby can develop pressure on the stomach and can affect the function of sphincter. Second, hormonal changes. Additional lifestyle changes for pregnant women. Number 1. Eat 6 to 7 meals a day. Number 2. Do not drink anything after a meal. Number 3. Avoid fatty, fried and spicy foods. Avoid soft drinks too. Number 4. Avoid eating before going to bed. There should be 2 hours break between eating and lying down. Number 5. Lift the head of the bed. Lift the head of the bed, it prevents from heartburn. Or you can use more than one pillow to prevent heartburn during sleep. Number 6. If you would like, you can drink a small amount of fat-free milk, skimmed milk, before eating. Number 7. Avoid alcohol and aspirin.